Good morning, everybody. We'll get the webinar started as it is 10 o'clock. First off, welcome to the MyARTA Health Hub desktop navigation webinar. Today, we're going to walk you through the new MyARTA Health Hub and demonstrate to you how to access the new and improved claims portal. First off, I'd like to introduce Rosie Borelli. She is our Senior Member Services Administrator who will be doing the demonstrations for you today. We also have Amanda Shaw, who is our Chief Marketing Officer. And my name is Jennifer Hope, and I'm the Manager of Marketing Promotions at ARTA. And Amanda and I today will help answer any questions that you guys have that come into the Q&A box. So just a few housekeeping notes to take. This session is being recorded, and we will be posting it on our YouTube channel, so you can go back and watch the video again if you would like. So for this reason, your video and microphones have been disabled just to ensure your privacy. If you have any questions throughout the webinar, please use the Q&A function in Zoom. So it's just those two speech bubbles in your Zoom menu. So just type your questions into there, and Amanda and I will answer them as they come in. But we will also have some time at the end to answer questions that do come in as well. And with that, I will pass it on to Rosie, and we will get the demonstration started.
Thanks, Jen. Okay, I am very excited to be hosting my first webinar this morning, so thank you all for joining us. Let's get right into it. So we are going to first log on to a MyARTA account. If you don't have a MyARTA account, you can simply click here and register for your MyARTA account. Once you have logged on, you're going to want to click on the Coverage and Claims button on the top left of the page. This then redirects you to the MyARTA Health Hub, and this can take a few seconds. The first thing we're going to do this morning is submit a few claims. So as we can see, the Submit a Claim button is right here in front of us. We'll click on that. And then we can see, what is this claim for? You have two options here. You can simply type in, let's say massage, and it will populate for a massage claim. Or if you don't know exactly what you're looking for, it's an alphabetical list, and you can scroll down and then we can find massage. Next, you'll select your provider. If you've made a massage claim in the past, you might see a provider under your recently visited providers list. If this is your first massage claim, or if you've recently switched to a new provider, you can click the Search Providers button near the bottom of the page. You can then search by phone number, the last name of the provider, or the business name. Keep in mind that this function allows you to search providers from across Canada, so you need to try and be as specific as possible here. If your provider has a common name, or if the business has many locations, you may need to search through a list to find the one you're looking for. For this example, I'm going to use the last name Miller. And as you can see, over 222 providers populate because it is a common last name. We always recommend using a phone number just to help narrow down those search results. So then I'm going to simply type in the phone number of my provider. And then we'll hit search again. And as we can see here, my provider pulls up and I'm able to select the one where I've received the service and the address matches. If you're unable to find the provider you're looking for, you can simply click Add a new provider and fill in the provider's information. However, since I was able to find my provider, we are going to continue on with her. Next, we need to indicate if this claim is for the member, a spouse, and any dependents. In this claim, we're going to say that it's for Phoebe, a dependent on the plan. Next, we need to indicate whether there's an additional source of coverage. Additional coverage does not include any provincial coverage, but would include an employer-sponsored plan or a spousal's plan. ARTA does not require any prescriptions for paramedical services, such as massage or physiotherapy or chiropractor, so you can indicate that you do not have a prescription as one is not required. Next, we need to indicate if this claim is related to a motor vehicle accident or a workplace injury, and we're going to select no. Finally, now we can get to selecting the treatment date, length, and the total cost. For this treatment, we're going to say we went for a massage on the 11th. The treatment length was 60 minutes, and the total cost of the massage was $110. You can also make multiple claims at the same time if you have multiple claims to make through the same provider. All you have to do is simply click Add Additional Purchase, and then you can make a massage therapy claim for the same provider. If at this point you don't have to make a multiple claim, you can simply click the Remove button right here on the top right-hand corner. We're going to go and continue to review the claim. This gives us an opportunity to check over the information we've provided to make sure that it is accurate and ready to be submitted to ARTA. Everything looks good, so we will check off the box right there, and then here's where we can submit our claim. As you can see, we have now submitted the massage claim, and this page has been updated with live information in regards to our claim. This is an example of ARTA's real-time adjudication, which allows us to see the results of some of our claims immediately. Not all claims are going to be adjudicated like this in real time. It depends on the complexity of the claim or the time being claimed. Many claims still need to go through the standard adjudication process. So what we're going to do is we're going to go down here and click Submit Another Claim, and we're going to walk through the standard adjudication process now. So we're going to search for a hearing aid claim. And then we're going to search for a provider. For this example, I'm going to, instead of searching by provider last name, I'm going to want to search by the provider business name. And as we can see, if we type in Hearing Life, over 300 different Hearing Life locations or providers populate that way. So I will need to narrow down my search again with that phone number. So I'll simply type it in here. And then we can hit search. Then it pulls the exact Hearing Life location where I had purchased the hearing aids at. If you encounter any difficulty locating your provider, you can easily click on Skip Provider Search, and this will prompt you to upload the required documents for submitting the claim. However, since we were able to find the provider, we're going to click Continue with this provider. So at the top of the page, you can find a text box that reads, "A prescription is required only for your first hearing aid claim through ARTA. Once your claim is processed and paid, future claims won't need a prescription. You can upload this prescription in the additional claims details section below." This message is a reminder that you may need to upload a prescription. Next, we need to indicate whether this claim is for the member or any dependents. This claim, however, is going to be for the member, Johnny. We will then need to indicate if there's an additional source of coverage, and then indicate if the claim is related to a motor vehicle accident or workplace injury. Now we can click and upload a file and find where we have saved the paid hearing aid claim, and then a prescription if required. So I found my receipts, and as I can see here, I found my hearing aid receipt that I need. And you can add multiple files to this. And then my hearing aid prescription. You are also given an opportunity to add any additional information that you may see fit, but this is completely optional and you don't need to add it. For this example, I'm just going to put this claim is for Johnny. And then we're going to continue to review the claim. Again, we'll have that one final opportunity to check over and make sure that everything is correct here. If you're worried about accidentally uploading the wrong prescription or receipt, you do have the opportunity to edit this as well. Once I'm satisfied that everything above is accurate and it's ready to be submitted, I'm going to click confirm, and then we're going to submit the claim. So as you can see, this claim is currently processing and it is being processed by ARTA's adjudicators. Now, if we want to get back to the home page, we simply just have to click on the MyARTA Health Hub on the top left-hand corner, and it will take us back to the main dashboard. At any point you need to get back to that main dashboard, you're always able to click the logo up at the top. We're now going to submit another claim. We're going to look up a drug claim. If you ever need to submit a drug claim, you can easily type in drug, and then you are able to indicate whether this claim is for Johnny or Phoebe. In this instance, we're going to say that the drug claim is for Johnny, and then indicate if there is an additional source of coverage, and if this claim is for a motor vehicle accident or workers' compensation. And then just like before in the hearing aid claim, we're simply going to upload the pharmacy receipt. In a drug claim, you are able to upload multiple pharmacy receipts for processing. You don't need to do this individually, as the claims adjudicator will go through the receipts and process them accordingly. And then we can click continue to review claim, making sure all of our information is accurate and ready to be submitted, and then hitting confirm. And this has now also been submitted to Green Shield. We are going to submit one other claim, and this is going to be a dental claim. So when we type in dental, this populates numerous options. If we're wanting to submit a dental claim, such as you went to the dentist and got a teeth cleaning, you're going to be wanting to select dental services. However, you may see the dental estimate for services, which means that you want to submit a predetermination for an upcoming dental service. ARTA always recommends submitting a dental predetermination for anything over the $300. So we're going to click on the dental services, and we're going to search for a provider. And this time I'm just going to go right into searching by a phone number. And as you can see, it pulls up my dentist right away here, and I'm able to select the provider. You also have the opportunity to skip the provider search if you have any difficulty finding the dentist office that you attended the appointment at. We are, however, going to hit continue. And this claim is going to be for Phoebe. And again, we're going to say no for the additional source of coverage. However, this is new. So this is going to be a dental form example. So if we click on this, this is what you may receive from your dentist office. This is a standard claim form. But you'll need to follow exactly what's on this claim form, as it will tell you all the procedure codes or tooth codes needed to make this claim. We will then click no for, is this claim related to a motor vehicle accident or workers' compensation? So for this example, I am going to say that I received 1 unit of scaling. I do know the procedure code for scaling. And then the dentist fee, I also am going to follow the fee guide on this one. And there is no laboratory fee for the scaling. And of course, you do go to the dentist quite a bit for multiple procedures. So it may not just be you're going to the dentist for 1 unit of scaling. You may have received multiple units of scaling and a cleaning. So then you can continue adding on these additional purchases, and you will find all the information needed on that standard dental claim form that the dental office will provide you. But for this instance, I'm simply just going to remove this. And we're going to continue to review the claim. As we can see, we want to have one final opportunity to make sure all the information is accurate and ready to be submitted. And then we're going to submit the claim. And as you can see, the claim description shows the scaling for 15 minutes. And this was live time adjudicated. And it's currently in progress. We're going to now click on the MyARTA Health Hub logo, and that's going to take us right back to our dashboard. We are now going to go to our claims history. So there's 2 places where you can find your claims history. If you go up top under claims and benefits, you can easily see claims history here. Or if you scroll down a little bit further, you can see all recent claims that we had just made. And then we can simply click on view all claims to view the entire claim history or submit a new claim. For this example, we're going to want to click on view all claims. After a claim has been submitted, you are able to view it in your claims history, and you will be able to view it for up to 12 months. We can see our recently submitted claims are in progress, and then we can see some claims that have been previously put through on this test account. We can click very easily now and access the statement for the processed claims. So we're going to look at Johnny's recent massage therapy visit, and we're going to pull up and view that statement. And as we can see here, the statement populates very easily, and then we do have the option to print the statement as well. You are also able to view statements for denied claims, and once these claims switch to from in progress to processed, you will have statement for all those as well. We can also filter our specific claims. So let's say we're looking for all of our massage claims. So we're going to click the filter button. And we're going to just be looking for BB's massages. And we want to pick claim type. And then we want to click on unselect and select all. We want to scroll down and we want to find massage. And then we want to make sure we're getting the claims paid to you, which is us, and our health provider. And then if we hit apply, both Phoebe's claims here for massage show in progress. You can also create a claims history report. This allows us to create a printable summary of certain claims. You are able to customize this report. So for example, if we're wanting to look at Johnny's claims and we are wanting to look at just Johnny's claims, nothing else, and then just certain claims. So let's say we want to look at his massage claims and his dental claims and his hearing claims. We were able to pick through those claims, and we can change the service date that we want. Right now, it's just defaulted to a service date. And then paid to, we're going to keep this by us and the health provider. Once we create this report, we are able to see all the claims for hearing and for massage. We can easily print this report. very easily. And then we are also able to run another report if you're wanting to do it for a dependent on your file, multiple dependents. It is a very easy tool to use. Perfect. So we're going to click on that MyARTA Health Hub logo again, and it's going to take us right back to our dashboard. We are now going to scroll down, and we're going to click on Find a Provider. So this Find a Provider feature allows you to search for an accredited provider in your area. By doing this before making an appointment, you can always ensure the providers are approved by ARTA and even check to see if they have arranged direct billing. You should see a map that shows your home region, or if you're traveling, the region of the area you are visiting. However, this current map does not match that. That is because at the top right-hand corner here, it's going to ask you if you would like to allow the Health Hub your current location. We do want this, so I'm going to click Allow here. Once it's allowed, it then generates our current location. If you have any issues with this, again, I can only speak to Google Chrome because that is what I'm using. But you can see up here on the top right-hand corner, this button. Make sure that this is turned on to continue allow using the site access to your location. If this button happens to be off, and we can refresh it and I can show you what it does, but it will always take you to this, this Detroit location, and you will not be able to access your current location. So we're always going to keep that on. If your web browser is different than the one I'm using, I would definitely suggest just doing a quick Google search and seeing how to turn on your location services. Once we have our location set, we can definitely start looking for our provider. So we're going to click on the first drop-down menu here, and we're going to look at massage therapy. And then we're going to hit search. So as you can see, a bunch populate in the exact location where I am right now. So if we use the plus and minus buttons, we can zoom in and out of the map. So as you can see, this is my current location as I'm at the Edmonton office here at ARTA. However, let's say, no, I'm not wanting to look for a massage therapist around this area. I'm wanting to look for one closer to home. You'll just simply have to drag the map, and then that will populate the massage therapist in that specific area on the map that's shown. Okay. And then we'll zoom out again. So if you are looking for a specific provider, you can add those additional details into the next search bar here. Again, you can look by the provider name, the phone number, and the business name. However, I again would suggest using the phone number as it will pull the best results. So for our example, I will type in a phone number. And we will hit search. And as you can see, this has pulled up all of our different providers underneath that one business. So all the massage therapists under this specific business's phone number, instead of if you were to search something like Smith, and it would populate hundreds of Smith massage therapists in the Edmonton area. We can also click the filter button to find delisted providers. So I'm going to remove this phone number here. And then we're going to go over here to the filter button, and then we can click on delisted providers and click apply. So delisted providers are those who have closed their businesses, moved to a new location, or are under review by ARTA's claims adjudicator. If you have used a delisted provider, you will not be able to make a claim for their service. As you can see here, it states very clearly that that provider has been delisted. Okay, perfect. We are now going to go back to our dashboard. And we are now going to be looking at check coverage. So there are two ways to look at check coverage. You can simply go up here and click on the check coverage, or you can scroll to the bottom, and again, you can check your coverage down here as well. So this page will allow you to check both the type of coverage you have through your ARTA benefit plan and the remaining balances you have in each category. Your eligibility may look a little different than this example, just depending on the type of benefit plan you have. Near the top of the page, we can see a search bar where we are able to search for coverage, such as massage, or we can look through specific products such as medical supplies and equipment, and then continue on to garments, casts, and braces, and narrow down our search by there, just depending on how you want to search. For this example, however, we are going to search for a massage. So we're going to fill in the information. Again, we're going to be searching for Johnny for this instance. And then this service or purchase date, we're going to leave as today because we're thinking about going to get a massage today, and the duration of the massage, how long we're going to go for. Today, we're going to go for a 90-minute massage, and the estimate amount of money that we're going to spend at this massage is going to be $150. This doesn't have to be the exact cost, but you want to try and get as close as possible to the actual cost of the bill before any reimbursement is made. Once we're ready, we can click Continue to Estimate. So since this page has loaded, it gives us a breakdown of what we can expect from coverage in this category. You can see if a prescription is required, and it is not for all paramedical practitioners. But then also it gives you how the cost breakdown works. And if you scroll down, how much money you have currently used for your paramedical maximum. So currently Johnny has used $175 out of his paramedical practitioner maximum for the calendar year. ARTA's calendar year for paramedicals runs from January 1st to December 31st. Keep in mind, though, that this is an estimate based on the information you provided. If the information is different from when you're ready to make the claim, the data shown here may be slightly different as a result. You would like to keep this estimate on record. You can very easily print this at the top by clicking Print, and you'll be able to print this out for your records. Or if this is exactly what you were looking for and you're wanting to look for another estimate, you can conveniently just click the Get Another Estimate button, and it takes you right back to that page. We're also going to go over a drug lookup. So if we click on drug here, and we're going to be looking for Johnny Testman. So if we're searching, if we search broad under a drug such as trazodone, it's going to bring up several different strengths. Okay, so that will happen anytime you just simply search the drug name. However, if you have the drug identification number, or what I like to call it, the DIN number, you're able to be as specific as possible because it's showing the exact dose. So if we take that away and we put in the DIN number, you can then see that it's pulling up exactly the one that you're looking for. A pharmacist or your physician should be able to give you a DIN number for us to be able to look up. And we can check right here that, yep, you would be eligible for that coverage. We can also do another one by a lookup. The metformin, and we can see that it is eligible as well. I would highly recommend using this tool if, let's say, your physician's wanting to prescribe you a new medication and you just want to check to make sure that the ARTA benefit plan covers it. You can come to this web page and simply type in the name or the DIN number if you have it. Perfect. So we're now going to go back and we're going to scroll down to the bottom and we're going to go to where it says View Personalized Claim Forms. So you have two options here. You can click our general claims admission form or a dental claim form. So we're going to do the general one, and then it also varies by the member or any dependents that they have. We're going to get it for Johnny. And as you can see here at the top, section 1 has been pre-filled in to making submitting a claim easier. So if you ever want to submit a claim by mail, you can simply go onto the website and print off a claim form here.
Rosie, while you're there, there was a really great question about submitting claims incurred in other countries while on vacation. So because only Canadian providers are listed within this system, using this personalized claim form is a great way to submit those out-of-country claims.
Yes, and we can also submit a claim. That's an awesome question. Let's say you went to Mexico and you received a massage in Mexico. Another way that you can submit a claim is by simply typing in Mexico here, and it's going to show nothing is found. But what it's also going to do is you can click here to submit your claim and estimate. And from there, you're able to upload those receipts for adjudication as well. Hopefully that helps. And it doesn't have to necessarily be Mexico. That was just an example. Like, let's say you were in the United States and received a massage. You can simply type in United States and this will populate as well here. Okay, perfect. I will now turn it over to Amanda for a moment, who will briefly go over our health services offered on the MyARTA Health Hub.
Yeah, so one of the things we're really excited about with this new platform is it integrates health services directly within the portal. So all ARTA extended healthcare plans include access to telemedicine services and counseling services. These services are an excellent way to supplement your existing healthcare coverage, especially when you're traveling or if you don't have easy access to get a quick prescription. This platform works wonderfully for our primary plan members. Any spouses or dependents also have access now to create their own virtual care account and access these services as well. So I'll put a link in the chat that you can share with your covered spouses and dependents if they're interested in accessing counseling or telemedicine services. If we have any ARTA members here who are outside of the province of Alberta, they'll also have access to an online pharmacy, which allows them to get a prescription online and then submit directly to the pharmacy online and then have it delivered directly to the doors. Unfortunately for our Alberta residents, due to some licensing stipulations, they do not have access to this, but we hope that maybe that changes in the future. Rosie's going to give a demo of how these work, but we're really excited to have these here for our members to use directly where they submit their claims as well.
Thanks so much, Amanda. Okay, so for the counseling services, we can go here and click on Connect with a Counselor. And so yours will look a little different than mine. Currently, it says for individual counseling, I have a half an hour left. Yours will say 5 hours and 5 hours for couple counseling. The first thing that you guys are going to want to do when you do come on to this page, though, is you're going to want to match with that counselor. So matching with your counselor is a very important part in the counseling journey. You're able to match with a counselor and have a 15-minute consultation with that counselor to make sure that you and yourself feel comfortable going to them. If after that 15-minute consultation happens and you don't, you can always match with a different counselor and have another 15-minute conversation. Our calendar year for this counseling service, though, runs a little different than ARTA's normal calendar year. It does run from November 1st to October 31st. Those are when those 5 hours will reset. And then we are going to go back into health services, and we'll also go through the telemedicine here. And so here you are able to talk to a general practitioner. You can also set someone else up in your care, but for this example, it would be for Johnny. And then the province that he is currently residing in, which is Alberta. And then we're going to be sticking with the general practitioner and hit continue. And then it will simply go through what Johnny's experiencing today and why he needs to see the physician. So let's say, or an example for this one, he's experiencing the cold and flu and wants to talk to a physician and maybe get a prescription. You don't need to put the prescription name in here though, because of course you may not need one. It's just a discussion to have with the physician. We can also write down any details that Johnny is feeling as well, and then continue to confirm those details. Oh, we have to put something in here. And then we can continue to the provider pairing. And then they're matching us to a provider. We can also upload any files, like let's say you had a skin rash and you were concerned about it, you can simply upload a picture of it or a past health diagnosis as well. I am going to exit off this page though, because we don't want to actually meet with a physician today. And then the last thing I'm going to go over is work health and life services with you guys. Okay, so for work, health, and life services, members also get the opportunity of 5 hours of career coaching, health coaching, and then life transitions. And then they also have the opportunity to have a legal consult and a financial consult. So this does work like our counseling, where you would click here, like let's say for career counseling, we do see that we have the 5 sponsored hours. So after those 5 sponsored hours, it would cost $90. And then we can start a request and we can start thinking about what am I going to be wanting to do in a career counseling? Should I be planning for my retirement? We're going to click next. We're going to provide an email address, and then they're going to reach out and contact you and set up those appointments as well. Okay, perfect. And so the last thing that we are going to go through today is our support center. So anytime you need support, I would highly recommend going up top here. And I would encourage every single one of you to visit the Help Center. So the Help Center is great to find numerous articles on simply how to navigate the MyARTA Health Hub. So as we can see here, there's an article on how to navigate the dashboard. And then it'll explain exactly how to navigate the dashboard. Or there's an article on how to find care providers. So something that we went over for Find My Provider today. However, there is also articles answering many frequently asked questions. So if we click on insurance and benefits, and then let's say one of my frequently asked questions that I've always wanted an answer to is, when will my claim be processed? There's actually an entire article written out on when your claim will be processed and what that time frame does look like. Okay. If you still require further assistance while using the MyARTA Health Hub, we always recommend giving us a call at 1-855 444-2782, and one of ARTA's member services team members can use a feature called Screen Share. So I will show you guys how that works. So if we click on Support, and then we click on this Screen Share button, it's going to populate a 6-digit code in the bottom right-hand corner. You will then give that code to the ARTA Member Service Administrator, and this will allow them to see what you see on your screen in real time. And they will also be able to help you navigate around the site and answer any questions that you may have. And then lastly, there is a Contact Us button. Of course, this is our phone number right here. If you have any questions or concerns, please always reach out. And then if you have any questions or concerns or having trouble with the health services, there's also a number here provided that you can give them a call and they'll be able to help you. Okay, perfect. I want to just thank everyone so much for joining us today on my first webinar. And yes, I'll open the floor to any more questions that you guys may have. Continue to drop them in.
There was one great question earlier on, and I just wanted to kind of reiterate it to the entire group. In Rosie's example, she had her receipts saved to her folder and was uploading the receipts that were saved to her folder. This is really just to make sure that the webinar went really smoothly. You can also drag and drop. So you could drag and drop a receipt that you maybe have saved in an email, or you could take a picture. Multiple file formats are accepted, including image files. So you could always take a picture and upload and submit a picture as well. As long as the receipt is clear enough for the adjudication team to read, you can submit multiple file formats. It's great to save your receipts and have them handy. And an important thing to know when using the portal is that in security cases, it will time out after 10 minutes. So saving those receipts to an easy to find place will make your claims process just a lot smoother, and we recommend that. We are recording this webinar and we will post it on our YouTube channel. I can put the link to the YouTube channel in our chat, and so you can certainly rewatch it at any time. Rosie has also been very hard at work filming all sorts of tutorial videos. So if you have really specific claims that can sometimes be complicated, a great example is chiropractic claims in the province of Alberta for residents over age 65. You can find all of those tutorial videos on our YouTube channel.
There was also a question about direct billing. If your provider does do direct billing, you do not need to come onto the claims portal and submit a claim. So if your dentist or your massage therapist does do direct billing, you don't need to worry about submitting a claim online. Okay, so I don't see any other questions coming in. So thank you so much for joining us today. Again, this webinar will be on our YouTube channel, and thank you so much to Rosie. You did a great job in going through the webinar.
Thank you.
Sorry, there's one more in regards to travel care claims. So our emergency travel claims are processed by Beneva, our emergency travel provider, and are not done through this portal. Rosie, can you navigate back to myarta.net, or can you navigate to where they can go to there?
Yes.
So if you go under the benefits and claims form section, everything you need to submit an emergency travel claim will be there, including the link to their online portal to submit those claims. So slightly different place for emergency travel, but that's how you can access it.
Okay, I don't see any other questions coming in. So again, thank you very much for joining us today, and thank you for being ARTA members.
Thank you, everyone.